Welcome back. So tonight or this evening, wherever, or this morning, whatever part of the world and whatever part of the time it is. So today we're going to step into the jungle. So into the world before scalpels, before antibiotics, before sterile fields and sutures. We're going to be looking into the Mayan civilization as seen through the relentless eyes of that movie called Apocalypto. I remember watching it. Definitely, I was in New York, yeah, and I watched it, and it was amazing. It's directed by Mel Gibson. I like the movie. It's not just a movie, it's actually a lot of things are happening in it. Like, there's trauma medicine, there's infectious disease, remember the fire ants, there's survival physiology going on. So, this is Diabetic Profiles, and today we're gonna dive into another episode of Cinematic Wounds with Dr. G, yay. So, in Apocalypto, we follow Jaguar Paw. So Jaguar Paw, who is he? He's a hunter whose peaceful forest village is shattered by raiders, right? They raid the village from a declining Maya city-state. So, what follows is a brutal chase through dense jungle terrain filled with penetrating spear trauma, blunt force cranial injuries, deep lacerations, infection risk in tropical climates, psychological stress under extreme cortisol load, primitive but indigenous wound management. Forgive me if I don't pronounce that right. But beneath the blood and the violence lies something deeper. What's happening in this movie is the collapse of civilization, the biological impact of European introduced pathogens, the ethnobotany of the jungle medicine, the raw biomechanics of survival. So, in today's episode, we're going to examine the wounds not as the Hollywood props, but as a living biological events, okay? Because every injury tells a story, every scar records a civilization, and every infection rewrites history. So, let's get into cinematic wounds, Apocalypto. So, who were the Mayans really? So, before wounds, we must understand the people, correct? In this movie, Apocalypto, which is amazing. It's a great movie. I like it. So, the Mayan civilization, it lasted from 2000 BCE to 1500 CE span. So, the Mayan civilization spanned to modern Mexico, Guatemala, Belize, Honduras, and El Salvador. And we're not talking about primitive jungle tribes. They had complex astronomy. They had accurate calendars. They had advanced mathematics, like concept of zero. They had massive urban cities. They had sophisticated agriculture irrigation systems, and they had a structured medicine practices. So by the time depicted in Apocalypto, many great Maya cities had already declined due to the drought cycles, the overpopulation, the resource depletion, and warfare between the city states. But they were still medically innovative. So there's this scene which is pretty much biologically fascinating in history, and it was them using fire ants as surgical staples. So, certain indigenous groups in Central to South America use army ants as wound closure devices. So, what is the mechanism of that, using army ants? And oh, yeah, disclaimer again, this is for medical education only and entertainment. This is not for anybody to use. Do not use fire ants. Do not use any of this. This is for knowledge. That's it. Yeah, you should not be using fire ants. I shouldn't have to say this. Common sense, make common sense common. I shouldn't have to say this. I'm telling the truth, okay? In a generation with all this knowledge, I shouldn't have to say that. You should already know that. But let me get back to it, okay? So they used army ants as wound closure devices. So the mechanism was it would bring the wound edges together manually. They would. And then they would place the head of a live ant across the laceration. And then the ant bites down as it, like, it's like a reflex for the ant to bite down. And then they would twist the ant body off. And then the mandibles remained clamped onto the wound edges. So it acted like staples. So why did this work biomechanically? So the ant mandibles, like their jaws, right, were extremely strong relative to their size. They would lock mechanically, and it would provide an immediate tissue approximation. So this is similar to modern skin staples or Maquette wound clips. And the advantages of this would be immediate closure, reduced bleeding, no thread required, a natural biodegradable material. So how did the fire ants really help? Like we said, it re-approximates approximate sorry approximated the wound edges together. So but it wasn't the ants that made it repair, right? It just put the wound edges, like reapproximated the wound edges, right? That's not what repairs them. They were just locking it together. So once the wound edges were approximated, the body can take over. And forgive me for my little miss up earlier. But we already know the phases of wound healing. How many phases are there of wound healing? There's four. Hemostasis, which is the first stage, which lasts minutes to hours, where the platelet aggregates, the fibrin mesh forms, and the clot stabilizes. Phase 2, inflammation, because it lasts hours to days. The neutrophils clear the debris, macrophages remove bacteria, and cytokines recruit the repair cells. And then we have the third phase, which is the proliferative phase, which I love. I love the proliferative phase. I love when my wounds start getting in that phase. The fibroblasts start building collagen, the angiogenesis starts, and then the epithelial cells migrate across the wound edges. It is a miracle and it's amazing. And I love seeing that proliferative phase. And then phase 4, the remodeling phase. The collagen reorganizes. Remember, it changes from type 3 to type 1, and scar tissue strengthens. It takes months. I think even the remodeling takes years, but they say months. Some people say months. But in the end, the fire ant's job was to realign the edges and reduce bleeding and prevent the wound from gapping open, which is what we call a wound dehiscence. Forgive me saying like, but yeah. So did the fire ants have any antimicrobial properties? So this is where it gets a little interesting. So the fire ants, they have something called formic acid in some species, and that creates a acidic environment, which inhibits bacteria. Remember, the normal pH of normal skin is acidic. So also they had antimicrobial peptides. So some ant species actually produce compounds that suppresses microbes. But you have to remember these ants are not sterile. They cannot carry they do carry environmental bacteria. So your infection risk is extremely high, especially in deep wounds. And in a healthy, well-perfused person, the immune system may be able to handle it. But if it's somebody who's immunocompromised, something like this is extremely, extremely dangerous, especially if the patient has poor perfusion and is a diabetic. So why did this fire ants thing work surprisingly well? It succeeded because the mandibles were strong relative to the ant size. They clamped tightly, they locked in, they created tension similar to a staple. They were the early staples, okay? They were staples, okay? They were biodegradable and you didn't need thread, okay? So that actually is a brilliant innovation. And you have to wonder, how did that person learn that? Like, when did they learn that? Like, did they just get bitten by a fire ant and was like, oh, this thing won't move, and they see the tension from the skin from the bite? Who knows? But what are the limitations with that? There are limitations and risks when it comes to something like this, which makes sense. It cannot close deep muscle layers. There's a high infection risk in contaminated wounds. Foreign body reaction is highly possible, possibly, okay? No appropriate not definitely not appropriate for abdominal impalement and cannot control internal bleeding, okay? This is, more in Apocalypto, they use the ants as more of a skin solution, not really a trauma solution. So would this work for a spare wound-like injury like in Apocalypto? So, if the wound is linear, not too deep, not actively hemorrhaging, not does not have any major organs involved, yes, it could help reapproximate the skin, right? But like we said, it does not stop the internal bleeding, does not prevent deep tissue infection, does not replace surgical intervention. But in the end, these are the modern parallels, and today, we use things like stainless steel staples, absorbable sutures, and adhesive glues like acrylate. You have to forgive me for my pronunciation. But Fire ants were essential. They were primitive biomechanical staples for the patient, for their actual patient. Okay. Next, what do they use in Apocalypto? Honey. They use honey as, or the Maya. They use honey as an antibiotic. I use honey. I love me some honey, right? You know how they say no, no money, no honey, right? Sometimes they say that, but the Maya used honey medicinally, and in modern medicine confirms that this was so brilliant. So it kind of confirms that these people were advanced in their knowledge. Okay, so in honey mechanism, honey has an osmotic effect. So the high sugar concentration pulls water from the bacteria, which dehydrates the microbial cell. The hydrogen peroxide production, so the enzyme that's released is glucose oxidase, which produces a low level of hydrogen peroxide, and this has an antimicrobial property, but yet tissue safe. Honey has a low pH, so most pathogens prefer a neutral pH. Honey is acidic. Remember we said the natural pH of a normal skin is acidic. So honey is acidic. So its pH is around 3.2 to 4.5. Then honey is also anti-inflammatory. So it reduces edema, it promotes fibroblast activity, and enhances angiogenesis. So then what is to now, that was Manuka honey dressing before Manuka honey dressing existed, okay? But in the jungle, honey would help decrease infection risk, promote granulation, and reduce necrosis. Next, the tree resonance. The tree resins were used as a wound sealant, an antiseptic, as well as an anti-inflammatory. So many tropical resins contain something called terpenoids, phenolic compounds, and flavonoids. And these compounds would disrupt the bacterial membrane, reduce the oxidative stress, and suppress the inflammatory cytokine. Resonance, I know I'm not pronouncing that the best way, but forgive me. Resonance also create physical barrier to contamination as well as a moist wound environment. So modern day comparison of that would be petroleum-based occlusive dressings, but resin is a biologically active. So some Central American trees like copal, which was used by the Mayan, have antimicrobial properties that are still studied today. Next is herbal anti-inflammatory science that the Mayans used. So the Mayan used chili-based things, bark extracts, leaf compresses, and many jungle plants contain salicylic-like compounds, salicylate-like compounds. So they were pretty much natural aspirin precursors. So the mechanism of that would be inhibit the COX enzymes, the COX enzymes, and that causes the reduce of prostaglandin production, and that decreases inflammation and pain. Others contain tannins, and tannins are like a astringent that tightens the tissue. They also sometimes contain alkaloids, which are allergenic, and then saponins, which are antimicrobial. This wasn't superstition, this was pretty much empirical pharmacology for them. But let's do the full breakdown of the spear impalement in Apocalypto, the full trauma breakdown. Okay, let's break down the critical injury that happened in Apocalypto. I mean, they did more than that, but so the anatomy of the impalement. So spear penetrating laterally could affect the skin, your subcutaneous tissue, your external oblique muscle, your internal oblique muscle, your transversus abdominis. And if deeper, it could penetrate or nick the perineum, the small intestines, the colon, the liver, or the major vessels. The fact that this person survived in that movie, Apocalypto, with the spear impalement means that it did not pierce the abdominal organs, it avoided the inferior vena cava, and it avoided the mesenteric arteries. So, what are some of the hemodynamic consequences of getting impaired by a spear in Apocalypto? Immediate risk would be hemorrhage, hypovolemia, and a neurogenic shock. But if the object remains, it can become a tamponade, bleeding vessels. Okay, so removing it can destroy the clot formation, cause rebleeding, and reintroduce bacteria deeper. So the modern protocol for something like this would be stabilize the object and remove only in a surgical setting. But in the jungle setting for survival in Apocalypto, they removed it so that they could be able to run, right? But honestly is biologically reckless. So, in Apocalypto, close to the end, that's when the Europeans arrived. And what did the Europeans bring? They brought invisible weapons. And the invisible weapons were things like smallpox, measles, and influenza, which pretty much was the real apocalypse for them. So remember, smallpox has a mortality rate of about 30%. Mechanism is the Virola virus. It has a massive immune activation. It causes skin pustules, sepsis, dehydration, and secondary bacterial infection. And indigenous population had zero immunity to something like this. So some regions lost about 50% to 90% of its population within decades. Then the measles. The measles, of course, are highly contagious, and complications of the measles are pneumonia, encephalitis, as well as immune amnesia. So it destroys your memory B cells. And so immune amnesia meant that even survivors can become vulnerable to other infections. Then they also brought influenza, which rapidly spreads because we all had it. The flu has been going around. I got it too, and the high mortality in native populations. So, secondary bacterial pneumonia was a common cause of death when these patients, I keep on calling them patients, they are patients, when these members of the population got infected by the European arrival in Apocalypto. So why was it so devastating? Because like we said, these people were isolated. There was no previous viral exposure. There was no adaptive immunity. There was no antibodies, no herd immunity. So it wasn't warfare. It was all about immunology. So entire cities collapsed, medical systems disappeared, and cultural continuity shattered. And so the true apocalypse of this was microbial. So, in the movie Apocalypto, Jaguar Paw survives because he is young, he's physically conditioned, his acute stress response is intact, and he had no chronic metabolic disease. His civilization dies because of the pathogens overwhelmed the immunity, the social structure collapsed, the food system failed, and the population density accelerated spread. So, one body survived the jungle, but a civilization cannot survive the whole biology of it. So, in the end, in the movie Apocalypto, the fire ants were innovative, the honey was pharmacology, the resin was biochemistry, and the spear was anatomy. In this, that's what we're covering. But the virus was the evolution and pretty much the real apocalypse for these people in this movie. So, human beings can survive blades, starvation, and blood loss, but they cannot survive a pathogen that their immune system has never met. So I hope everybody liked this episode of Cinematic Wounds with Dr. G. And don't forget to take care of your feet because they take care of you.